Navigating Your Health Today is pleased to introduce Dr. Deepak Shrivastava. Dr. Shrivastava comes to us with a wealth of knowledge, board certified in pulmonology, respirology, internal medicine, gerontology, and sleep. Dr. Shrivastava shares with us today considerations for use of PPE such as face masks.
Every month, I evaluate hospital staff who are being tested for N95 and similar masks. And claustrophobia is a reality. Many of them can be desensitized, others cannot be desensitized, and they have to be given the modified job where they will not be required to wear the mask to continue their occupation. So that's very important. Having said that, there are patients that we see, they have very brittle asthma, for example, and they cannot rebreathe the air from the mask and begin to have problems. Or they had the history of spontaneous pneumothorax, and you really have to assess the risks if this was one episode of pneumothorax or they continue to have recurrent spontaneous pneumothorax. So there are certain high-risk situations where you will be careful in recommending even the testing, let alone wearing the mask on a regular basis. So that's really important point to ponder. In the context of the mask, actually, there is a lot. There is one thing that's coming up recently, and I'm sure that everybody has read in the press, that these masks, that whichever mask we are using, the homemade clothing mask or surgical mask or N95 mask, there is a certain amount of rebreathing of the air, and it is causing headaches to people. And I think that has become more of a nuisance. I have not heard that it has caused any cluster-like headaches or migraine-like headaches, but nevertheless, it's common enough that this has made it to the press and to the media. So that is something that one has to be careful with, and they have to find a place where they can safely remove the mask and breathe without the mask and not rebreathe their own exhaled air, which causes the problem. There are no recommendations that I read, but just by way of my pulmonary background, I would like to take that question because if there is no background, it is difficult for anybody to say that with a level of certain confidence that that's what it is. But I would suspect that people who are, let's say, morbidly obese, and they have a condition we call obesity hyperventilation syndrome, or they have emphysema or similar situation, some neuromuscular disease, where they actually retain CO2 even without the mask. And I would suspect that it will be difficult for people like that to wear a mask where they are rebreathing their exhaled air in the setting of a high CO2 to start with. And I wonder what would happen to those people in terms of the CO2 going up, whether they will get the headache or not get the headache, and whether they will become more hypoxemic or not become more hypoxemic. That remains to be seen. But clearly, I think that that group of patients will be a little more susceptible to complications for wearing the mask for a long period of time. Ideally, I would think no. There is a lot of reserve in the brain for oxygen. When I say lot, maybe 4 minutes of oxygen if you don't breathe at all. And so there are buffers in the physiologic system, and they protect us from getting these. Having said that, there is condition, everybody knows, CO2 narcosis. So yeah, you can have your CO2 going up so high where you become very sleepy and drowsy. So that's a possibility exists. And same thing is hypoxemia. The pilots who go to high altitude and in the small planes where the plane is not pressurized and they become hypoxemic, it's well known in aviation industry that they can get confused up in the sky, even when they are flying at a low altitude like 5,000, 6,000, 7,000 feet. So that's possible. First and the foremost setting is that you got to protect yourself and you got to protect others. When we say others, we are not talking about just the strangers. We are talking about your own family, your own friends. So it behooves if you don't wear a mask for some reason. Now, you really have to look at your own situation in terms of how long you can safely wear the mask and at what point you want to, surface for the fresh air, if you will. So that can be probably done on case-by-case basis. But when it comes to getting exposed to a situation where you are in a room, even maintaining the social distance with other people, that you wear a mask as recommended, and make sure that they also wear a mask for the same reason. Because airway is, well, it's needed for our life, but at the same time, it is also a media to create the aerosol, the fomites, and droplets. So even with the conversational air that comes out, that could be risky. So, we have the 6 feet that if you don't have a hard sneeze, you just cough like normal cough. I don't know what normal cough would be, but just you cough gently and you can have an aerosol going up to 6 feet, and that's how this recommendation came. So I would think that even with normal breathing, you will be able to exhale some aerosol that is probably not visible but could be potentially infective. I must use a disclaimer that as much as in pulmonary we learn about pollen and respirable particles and their size and what happens, still we don't have, at least I do not have access to that science that I can quote right now, that based on this clinical evidence you should be doing it. But I would say common sense dictates that we follow the recommendations that are coming out of the CDC and other organizations, especially your local public health.
Navigating Your Health Today is produced by Julia Worrell, the Sleep RN, and Director of Correct Sleep Solutions.